6 months after COVID vaccinations began in Ohio, the conversation has now started to shift to whether or not booster shots will be needed.
Well, that's a question many in the medical community are still trying to answer. The CDC and the FDA announced last night fully vaccinated Americans do not need a booster shot at this time. And then this morning, Pfizer announced it'll ask the FDA to authorize a third dose of its vaccine.
As News 5's Clay Lepard explains, for a local woman with health issues, the wait for an answer was too long.
We kept our distance from Jenny Woda, who began living the life of social distancing pre-pandemic because she received a kidney transplant in 2019 and takes anti-rejection drugs that lower her immune system.
From September to December of 19, I stayed in my house. I wore a mask anytime I left my house. I washed my hands and used sanitizer constantly.
When it came time to get a COVID-19 vaccine, she received her first dose of Moderna in February 2021 and her second shortly thereafter. Because of her compromised immune system, she quickly learned her body still had no antibodies.
I was fully vaccinated according to the CDC, but I had no protection as far as I knew.
That prompted a conversation with her doctors and eventually her getting a third and fourth dose of the vaccine beginning in May.
I got Pfizer because that's what they had.
She says her body finally started retaining antibodies with the extra doses, one end result for an experiment still underway. While some doctors are open to a third dose for people like Jenny, the CDC and FDA recently said no need for a booster shot yet. However, Pfizer announced it hopes to receive emergency approval for a third dose soon, arguing a booster 6 months after a second shot protects against the virus 5 to 10 times more than after just 2 doses. We reached out to a handful of county health departments and local hospitals who all told us they are not administering booster shots to anyone yet. However, plans are in place if and when they become approved.
As we get closer, I think, to the fall and to the winter, we will have much more data as to what our next steps will need to be.
Dr. Claudia Hoyen with Rainbow Babies and Children's Hospital fields that question pretty frequently. She points to the continuously evolving science and studies that surround it as to why we're seeing different strategies for a third coronavirus vaccine dose.
It personally makes sense for Pfizer to go ahead and make sure that they have everything in line so that if for some reason it's determined that we need booster doses, that there's no lag.
As for Jenny Woda, receiving 4 doses of the vaccine comes with a sense of relief, but still a cloud of questions.
Part of me feels like I have some antibodies, I have some protection, it would probably be okay. And part of me feels like, but you really don't know.
In Cleveland Heights, Clay Lepard, News 5.
Thank you, Clay. And it's not clear when the FDA will decide on Pfizer's third dose emergency authorization.